Okay, so let's get started. Good evening, everyone. Before we start, I have some rules to tell you before the presentation. So first of all, you should turn off your phone or switch into silent mode. If you are using a laptop, close unnecessary computer windows or applications to focus on the talk show. And you should mute or turn on the video into the talk show to focus on the lesson or to focus on the presentation. During the presentation, you should have a glass of water next to you and avoid noisy sounds. And the most important thing is all materials will be uploaded into the Zalo group. So it means that you do not need to capture the screen or not taking too much. So this is the rules and some notes I want to tell you before we start. Okay, so if you are ready for the talk show today, please comment number 1 in the chat box to let me know. Okay, so I can see a lot of number 1, right? So now we start the talk show. So welcome all of you to the talk show, Behavior and Genital Size. For those who don't know me, my name is Dung, and currently I'm a medical English teacher. So thank you very much for being here with us. So first of all, I just wanted to talk a little bit about the reason why we have a talk show today. So you know that Dr. Bac and I have already have have been working together for preparing the conference in Beijing, China. However, he had another plans, so he could not attend the conference. At that time, I thought his presentation was so informative and useful for me. So we decided to open this event to invite all of us, all of you, our doctors and our friends to join the presentation. And I hope that you can take home some key messages with us today. So we are so honored here. Let me introduce a little bit about Dr. Nguyễn Hoài Bắc. He is an andrologist and associate professor. He is also a head of andrology and sexual medicine department, Hanoi Medical University Hospital. And today he will give us a speech about behaviors and genital size. So please welcome Dr. Nguyễn Hoài Bắc.
Okay, thank you, Ms. Zoom, for having me. Thank you for your sweet introduction about me. Okay, let me share my screen.
Yeah.
Good evening, everyone. My name is Nguyễn Hoài Bắc. I am an andrologist at Hanoi Medical University Hospital in the department andrology and sexual medicine. And I am also an associated professor in urology at Hanoi Medical University. And I also a member of some professional association. Yeah, as you can see on the screen. Okay. This is my university where I spend my entire youth to start studying at Hanoi Medical University. This is the oldest and the most prestigious medical universities in Vietnam. And honestly, I am lucky enough. I have a professor. I have a dedicated professor and teachers. Some of them are now more than 100 years old. And they guide me to dig deeper in the field of andrology and sexual medicines more than 20 past years ago. So today I'm very honored to be here to share with you about secrets of man, a topic that is really discussed in Asian culture like Japan, Chinese, Indian, and Vietnam. Okay, my topics today is sex behavior and genital size. Before my starting, I would like to ask you all of you, how many functions of the penis? Okay, please give your comment in the chat box to let me know what are you thinking. Okay, okay, I see some comment here. Someone said that it's maybe 3, maybe 2 or 4. Okay, I think each man has one penis, which it serves two main functions. First, urination, and then second is the sexual intercourse. The second question for you is which function does the size matter? Okay, please give me your comment in the chat box, please. Oh, sexual and reproduction, Dr. Hung. Okay, endocrine and exocrine. Okay, anyone else? According to you, size does important which function, urination or sexual intercourse? Yes, I think for urination, size does matter, but I am totally agree with you that when it's become sexual intercourse, the size become a major concern of men. Why? Why the size become a concern of men when it's sexual intercourse? Because many men think that penis size is a symbol of man power, and then it is an impact. It is one of the most important factors in satisfying their partner. What do you think so? So my presentation today will have 4 main parts. First, I will tell you about size in different cultures. Second, I will tell you about size in real life. What do men and women think about size in their sexual life? And I will continue by what is more important for women in their sexual life. And the last, finally, I will mention potential solutions for men with limited size. And at the end of my presentation, I hope you will take home some key messages. Now we move on the first part, size in the different cultures. What is an ideal penis size? Have you ever think about it? Okay, I think what is an ideal size? Penis, what is an ideal size? It's a long-lasting question that has been debated for centuries. Okay, I can show you on the screen. We can see it on the size in the cultures. I think there is a big difference in the symbols, the important symbols of man in both European and Asian culture. As you can see, this is a picture in the European cultures. For in European culture, I think the symbol of man is a strong and muscular body rather than a large penis. As you can see in the picture, this man represents with his penis is much smaller than other parts of his body. But in contrary, in the Asian culture, you can see the symbol of man's a penis size is a symbol of man because it represents for the man power. So I think the large penis always represent with a much larger than other parts, other organ of the body. As you can see in the picture, in this statue, a man with a large penis next to a pregnant women. So why there is a difference in the perception of penis size among the culture? Let's back to the Ruston penis revolution theory. According to the theory, the colder the weather is, the smaller the penis is. So as a result, the Mongoloids, the Asian men belong to Mongoloid race, are considered to have a smallest penis among other races around the world. So, what do you think so? Do you think so it is true? I would like to ask a man, all the men in this room, do you think so Asian men have smallest penis among others in the world? Okay, what is the truth? As you can see, the data on this slide, the data compare the size penis of various reasons among different racial group. Yeah, the data show that Asian men who belong to Mongolians are living in the Asia have a large penis compared to a man belong to Caucasian population living in Asia, in Europe, you see. So, and in fact, we carry out a study that's measurements of penis of more than 14,000 men, Vietnamese men. The data show that the chest length of Vietnamese men is 14.67 centimeters. A similar study in China, they measured China's penis length. The data show that the China's penis length is about 12.9 centimeters. So we are Asian men. We are not small like what the world think about. The next questions I want to ask to you. Can we predict one penis size by other external characteristics? Can we? As you know, Vietnamese people always say that, checking the book by its cover. Is it true? If we can predict one's penis by seeing, by observation, their height, weight, BMI, foot size, etc. Unfortunately, the answer is no, because there are many study attempts to find a relationship between the penis size and height, weight, body BMI, foot size, etc. But they are failed to reach a consistent conclusion. The data in our previous study show that the penis size is qualitative phenotypes. So its variations are determined by gene, not by height, by weight, by BMI or other external characteristics. So, actually, the truth is only revealed when being naked. Now we move on the size in the real life. What about the size in real life? Is this important for both men and women? Is it big enough? I would like to ask all men in this room here, have you ever asked yourselves about, is it big enough? Yep, I'm sure. Nearly all of them ask this when we are younger, except myself. I haven't ever said this question for myself when I was young because I know about the importance. Okay, I think, is it enough? Is it big enough? Has become a big concern of the man. I can tell you from my experience. One day, every day, I have a lot of students. They come to see me in the clinic, representing the worry about having small penis, even though they have never had sexual activity before. Or some middle-aged men come to see me, request for surgery to increase their size, although their size is normal on examination. So I think penis size has become a everyday topic. Everyday topic of joking, even those after social gathering after work, and then the discussion about the penis size is become a lovely topic between the men. Why? Why do men always think about penis? Perhaps men always have compared their penis with other. Do you know the Chim syndrome? Have you ever heard about it? Chim syndrome is one of the Korean style. It is a public bath in Korean, where a lot of men take off all their clothes and to take a shower together in a community bathroom. So it is a good chance for men to compare his own to other. And then another reason is film sex, and depraved media, where the actors always have a large penis. So we have a tend to compare our own to the actor. So it is a origin for afraid of men of small penis of the man. According to the research, up to 30% of men think their penis is smaller than other. And then up to 45% of men desire to have a large penis. Oh, it's funny. So for most men, size is a big concern. The data shows that men with dissatisfied penis size have a lower self-esteem. Is it true? Yes. This data shows the level of satisfaction regarding achievements, swimsuits face among the different groups of men with small penis, average penis, and large penis. The data shows that the smaller penis size, the smaller the penis size, the lower the level of satisfaction. And the major concern about penis size also affects men's sexual activities. The data in this table shows that around 3% of men are dissatisfied with their penis, tend to avoid having sexual activity, and about 61% of them are hesitant to receive oral sex. Okay, what about the women think about the penis size? For them, for women, penis size is important for them. We will have the answer in this next slide. The women think that why there are 12% of men believe their penis is smaller than others, but only 6% of their partner admit it, and 80% of men's partner reporting that they are very satisfied with their partner size. So it is a big difference about the importance of size between the men and women. For most women, size plays some roles, but not all. So what is more important for women in their sexual life? What is more important? I want to ask you, all of you, the women in this room, what is more important for you? If you don't think that size is important, what is important for you? Okay, let me know. Please chat on the chat box. Okay. Reason I can show you some data. What is important for women? The recent study to investigate the preference of women about men of Chinese women. The data show that nearly all of Chinese women think that they only like the penis with a slightly longer penis than average. Only slightly longer, not big penis. They only prefer the average body shape and the chunk without hair, rather than the big penis. And an experience on the whether reducing the penis length on whether reducing penis length can affect the woman pleasure. The study showed that when reducing 15% of penis length result in 80% decrease in sexual pleasure. And the longer erected penis, the greater impact on the sexual pleasure. So, for women, harder is better than length. Not length, harder is much better. This is one study to investigate. This is one study this is data in the surveys of women about the attractiveness of the women about men using the 3D model. The data show that the shoulder hip breadth is more important than height and flaccid penis length. So, for them, masculinity is preferred more than genital size. What do you think about that? Do you think the masculinity is more important than genital size? Not really. I think not really. So, if a man have a limited penis size, are there any potential solutions for them? Every day, many men come to see me. They request a surgeries. They request a surgery procedures to penile enlargement. But I think in most cases, a proper psychotherapy is enough to solve this problem, not surgical procedure. There is some non-surgical penile enlargement. You know, fillers is one of the most techniques was used in penile enlargement, but the result is ineffective and unstable. What about the surgical? What about the surgical surgery? There are many surgical procedures to make a penis bigger. All of them can partially affect on the sexual function of the patient. So in many cases, as a result, in many cases, it may not eliminate insecurities about genital area. So the men tend to overestimate the importance of penis size. As a man, we can change our size without any consequence. Therefore, focusing on improving our skill rather than seeking an intervention to make it bigger. Remember that, make it strong and rigid enough to fulfill our partner. This is important. Thank you for your attention. Thank you, Mr. Dung, for supporting me in this presentation. Okay, this is some content of me, and then you can, in case we need to discuss some more topic. And this is some references that I use in my presentation. Thank you for.
Okay, so thank you, Dr. Bac, for very useful information, and I also learned a lot from your speech. Now I want all of us. Can you comment what you've learned in the presentation? Okay, can you share with us what you've learned in this presentation? And then after that, we will move to another part. Yeah.
Okay.
Very interesting presentation.
I would like to ask them, women in this room, what do you thinking about this topic? Is it useful for you?
Yeah, I don't know for others, but for me, for me only, I have never asked a question, and I have never think about these topics. And I don't think men have a big concern about the penis size. Maybe now I'm not get married, and right now size doesn't matter to me, and I don't know whether I change. I don't know whether I change or not after I get married. Yeah, I'm not sure about that. But I'm very surprised. I'm very surprised.
Yes, me too. I'm surprised too, because I don't know why the men always thinking why men overestimated about the importance of the size.
Yeah.
Sometimes it's always crazy. Men always crazy.
Okay.
Dr. Hùng, what do you think about this?
Dr. Lại Hùng, right?
Yeah, Dr. Lại Hùng.
Can you ask again?
Why the men think why the men always think thinking the size of penis is so important? Do you think so?
I'm thinking so, but it's not too important like everyone thinks. Because just don't be too soft. It dependent on our skin too, and it depends on our relationship with your partner, with our partner.
Oh. Actually, sometimes I don't know what about my partner. Because you can have a lot of partners, so you couldn't fit for all.
Okay, very interesting topic. Now we just move to another section, is Q&A, and we have 30 minutes for Q&A section. Now I see a lot of questions here. First question, I would like to invite Miss Nguyệt. Okay, can you unmute yourself and post your question?
Okay, thank you so much, Dr. Bac, for an amazing presentation. I'm really excited before this talk show, and I have some questions for you. And the first question is about the participants in your research at your clinic that you mentioned. Could you clarify if they are your patients or they are regular individuals? And is this condition applied consistently to all the studies that you mentioned? Okay, that's my first question. And when you answer the first question, I will ask the second questions.
Okay.
Okay. Can you, Mr. Zoom, can you briefly this question?
Yeah. Okay. Nguyệt, you asked about the survey on more than 14,000 men in the Vietnamese male in his clinic, right?
Yeah.
So he asked about whether they are patients with disease or they are healthy men come to you.
A good question. Thank you for the great question, because many people, when reading my research, they always get this question. Actually, this is a healthy man, because they are, all of them are come to my department for reproductive health checklist before marriage. So I think we should consider they are the healthy man. Yeah, not patient. In this our study, we include all the patients with a disease, some kind of disease.
Oh.
Okay, thank you.
Okay, and thank you, Nguyệt, for your question.
And I have another question.
Oh, thank you.
about the statement that I remember, we are not small like the world think about. And so I don't know what point you would like to emphasize with that statement. Is it the new truth that all men should be aware of, or is it something special important to boost their confidence for Southeast Asian men?
No, I think this is true, because the data show that the penis of the Asian penis is much it's larger, slightly larger than the some European men. Use it as I talk in Ruston penis evolution theory. Yeah, according to this theory, we are Asian men, belong to Mongolia, and Mongolia is considered to have a smallest penis because Mongolia move to the most coldest in the our Earth. So I think the Mongoloids are considered to have small penis size. But in the study, they saw that some men belong to Mongolian race have a large penis than Caucasian who living in the Europe country. So I think it is not, it is the truth. According to the data of Vietnamese men, we are 14.67 centimeter. It is much larger than some Europe country. For example, Holland and Iceland. Yeah.
Okay, so with this truth, are we feel more confident about this truth?
Of course, I feel it's more confident because we are.
so yeah, if we feel more confident about this truth, right? So size doesn't matter. Does it truly make sense? We believe because make confidence.
You know, for most men, size is a symbol of main power. So I am Vietnamese man, I am Asian man. So it is a symbol of main power. So I am very, very, very.
Okay, thank you so much.
Okay, thank you, Dr. Valen. Thank you, Nguyệt, for 2 questions. Now I think another chance for another participant. I see Miss Huệ Dinh raised your hand, right? Okay, so now maybe okay, let me unmute yourself. Chị Quyên first. Chị Quyên, can you raise your hand again to let me know? Your hand, the icon, your hand in the room. Okay. Yes. Okay.
Thank you, Dr. Bac, for your presentation. Thank you, Dung, for like a kind hosting today. So I have a chance to take part in surgery to make the penis bigger or longer before. As you know, a lot of men come to you in order the surgery of their penis. Would you share some your experience about how you can like intervene on the aspect of emotional and mental aspect before you go into do the surgery for them?
You mean how to measure the emotional and mental health of the patient before surgery, right?
Yeah, and how we can intervene and interview experience in your department.
Yeah, you see, in my department, I have one psychologist. He's one of the psychiatrist resident doctor. After graduate from university, I asked him to go to apply a position in my department. So every man before undergoing the surgical procedure for penile enlargement, always have consult with Dr. Duy. I don't know if Dr. Duy is available in our room today, in our meeting. Dr. Duy.
We see Dr. Dương Duy, right?
Yeah.
Okay. Dr. Dương Duy, are you here?
Oh,
yeah. Okay.
He's very handsome doctor and dental doctor. So I think he always have a long interviews for the patient before the surgery. Dr. Duy, are you here?
Yeah. Hello, everyone.
Oh, yeah, I am waiting for you to. Okay.
Yeah. Hello, Dr. Bac, Miss Dung, and everyone. Thank you very much for having me. Yeah, I'm a psychiatrist and also a psychiatrist. As you know, mental aspect is very important for a man before undergoing a surgery such as genital to impair their genital size. And the most important thing is their satisfaction. Many men, even though they undergone the surgery, they are not satisfied with their size, with the penis size post surgery. So for this man, we talk with them before or to clear up for them what the surgery is, if it will impact them, and to explain to them how we can.
Oh,
maybe his internet is unstable, right?
yeah, his is unstable. Maybe he's in cafeteria with.
Yeah.
Actually,
Okay.
this is a singer now. He's very, very. Miss Zoom. This is good news for you.
Okay, thank you. He's single, but he is in relationship. So I'm late. Okay. So maybe his internet is unstable. So I want to ask is it common for the penile enlargement in your department? Do you perform penile enlargement in your department?
Yes, you see, because I am a surgeon doctor, genital surgeon doctor, so I do I do the surgical procedures quite often. In average, about 10 cases a week.
Oh.
So I think, yeah, it's big, but almost nearly almost all of them are patients with abnormals in genital organ. For example, it's the length is too short or it's under the 6 centimeters. Yeah, this indication. Yeah, in this case, we have an indication for the surgical procedure to penile enlargement. In this case, it's the procedure is quite effectively, but for other cases, it's not effectively. So I think I have never done for a man with normal penis.
So you have a criteria to perform penile enlargement, right? So in case that a man have a normal penis size, so I'm very curious about how Dr. Duy can talk with them or to improve their self-esteem without surgery. Dr. Duy, are you here? Can you share with us about what you consult and what the Vietnamese male concern before the surgery, or how you pursue them not going to surgery?
Dr. Duy?
Are you here?
Yeah, I see him. Dr. Duy? Okay, maybe wait. Dr. Duy?
Yeah. Let me ask him to unmute. Okay, Dr. Duy, can you unmute yourself?
Yeah, Mike. Yeah. So I think consultation with the patient is the most important part before the surgery, because after consultation, many men, they rethink, and they know that they don't really need to undergo the surgery. So the question is how to make them change their mind I think we have to come back the most important point. That's why they want to go through the surgery. But they want to satisfy their partners or satisfy their esteem. For many men, I have to check their mental status, whether they have any kind of mental illnesses, such as depression, anxiety, or even psychosis, impact their focus of this. So after I do all the illnesses, I will go through the things their concerns about the size, increase their confidence, and maybe or to offer them many other kind to satisfy their partners without the surgery, because maybe they are not educated well about sexuality. Yeah, ever. Yeah.
Have you ever saw your own for the patient, because patient have to have a tendency to compare him with other. So if you want to persuade him, you say that I'm smaller like you. So it's exactly.
Yeah, I show them, but I only show the number. Yeah, I not show the picture. Yeah.
You show picture, not show yourself.
No, so the number, not the picture. Yeah.
So the number, not picture. Okay.
Okay, show the picture, not the real objects, right? So, Dr. Duy, I'm curious about besides the penis size, what are they concerned? What do men concern about besides genital size and penile enlargement? Can you share with us?
I think in the mental field, there are a kind of body dysmorphic disorder, and penile disorder is just a subgroup of that larger disorder. So I mean, such as in women,
I cannot hear you, Dr. Duy.
No, I cannot hear you.
Okay, back to Dr. Bac. Okay, if the Dr. Z cannot answer. So I think that for some men, after the consultation with the doctor, they also want to make it larger, maybe in another clinic to undergo the surgery. So can you share with us some complications they may suffer if they underwent the penile enlargement surgery?
Yes, I think yes, there are some complications about the penile surgeries. The first we can account it in infection. Yeah, infection is big problems when we when we perform surgical procedure to make penis enlargement. Sometimes we should place other artificial material to make the penile enlargement. So prevents infection is important. Yeah, to this procedure. And then the second complication that I encounter is scalp the penis. Yeah, when the penis becomes scalp, it's become very unreliable. So it makes the man much more disappointed about the result. So sometimes we have to redo operation 2 or 3 or even 4 times. Yeah.
Oh, even 4 times.
To solve this complication. Yeah.
Oh, Okay. Yeah, I see. Now I see.
Yeah.
Yeah. Now, Dr. Nguyen, do you have any questions? Okay, that's all right. Okay. Okay. Okay.
Yeah.
One more question.
Yeah, just one.
Okay, just only one question. Okay.
Yeah. Okay. I just wondering about how penile enlargement surgery can affect the sexual function in men. How, in particular?
Yeah, in particularly sometimes if we carry out the procedures with contraindication, contraindication is it can lead to some bad results. For example, it make scare in the penile, or it make it shorter than before, or sometimes some men with a mental problem before surgery. So after that, after operation, they become much more heavier than it influence both in physical and mental health. So it leads to the it will influence to the sexual life of the sexual life.
Yeah, it gets worse if unsuccessful. However, if it is successful, so is it better?
It's better. Yeah.
Is it better?
Yeah. Yes, of course. If it's better, if the result is successfully, yeah. If the operation is successful, the patient will satisfy with his penis. So it makes make the sexual life become much better than before.
Yeah. Okay. Chị Quyên asked about what the time or duration, right? Erection duration during sexual intercourse.
Yeah, I want to ask about how penile enlargement surgery can affect sexual function. How about the time, the duration of the erection? How about the quality of the sexual intercourse?
Yeah. Yes, I understand your question. Yeah. Sometimes some surgery can negative effects on sexual function of the penis. For example, it maybe it can last the time of ejaculation for long. It can last time for ejaculations too long, so it makes both men and women feel so tired, because at that time the men feel very difficult to reach organs to ejaculate. So this is one of the big complication. And another complication is it can make erectile dysfunction, because usually when performing surgeries, we can touch about blood vessels or nerve innervation. So I think both of them can affect about the functional erectile function, of the man.
Wow.
Yeah, very, very dangerous.
Yeah, very dangerous, right? Yeah, very helpful, useful information for me.
Yeah.
But now this is very first time I heard about it.
Okay.
Yeah. Okay. I want to ask our participants, do you have any questions? Please raise your hands. So I will unmute yourself. Okay, if you have any questions, so maybe you raise your hand or you can comment in the chat box. Okay. I see in the chat box we have a question from Dương Lê. Yeah. Thank you, Dr. Buck, for your presentation. And you have provided a lot of useful information. Can you estimate the number of penile enlargement surgery that you perform every year? And how much longer or larger can a penis die after the surgery? Okay.
Actually, after surgeries, we only increase the length of penis about around 2 centimeters. Yeah, it's not much. So it's only have a valuable for the people before the surgery is shorter. For example, if the people before if the patient before surgery they have penis with 6 centimeter, after surgery the length increase to 8 or 7 or 8 centimeter. It's useful for in this case. But for the normal penis, it doesn't matter. Yeah.
Oh. Okay. And how many cases that you perform every year?
About for enlargement about 45 or 50 patients a year.
50.
Yeah, 50.
50.
Yeah.
Person per year.
Yeah.
Okay, thank you. One case a week. Okay, I see Nguyễn Hiếu, you have a question, right? Okay. So what is your question? Hi, Dr. Hiếu, Nguyễn Huy Hiếu. Hiếu. You have a question, right? I see you raised your hand. Okay, thank you, Dương Lê. Dr. Hiếu, Nguyễn Huy Hiếu, do you have any question? Sorry, I cannot hear you. So can you comment your question in the chat box? Okay, anyone else in our room, do you have any question? So please comment in the chat box to let me know. Okay.
What about Dr. Phúc? Dr. Phúc, I can see your names, but I don't know. You can turn on your camera. Sorry, Dr. Phúc.
Dr. Hiễu Phúc, right?
Yeah, Hiễu Phúc.
Yeah. We learned in the same school.
Yeah.
Some university school, Vietnam Military Medical University.
Yeah.
Okay.
Okay.
Hello there. Hello, Dr. Bac. Hello, Ms. Dung.
Hello,
my dear teacher. I'm doing good. I'm still doing good, but actually my appearance today is not so good, so I'm sorry for not opening my camera.
Okay, no worries.
Thank you, Dr. Bac, for this very interesting.
Do you have any comment for about the penile surgeries or about afraid of men, about worrying of men? Do you have any comment about it?
Well, actually, I think nowadays the penis size is going to be the most important thing of the male when it comes to most thing about the intercourse. They can give them about the believing that they can showing the strength of what a man can have, at least in intercourse. And yeah, nowadays when we are developing so many procedures that can help men become more confident about the size. And I think the way now, Dr. Bac is now on the progressing of making the penis become more and more bigger. I hope that many guys can come to you and have a chance to make it become more confident for men. And thank you for that. That's all what I have to say. Thank you.
Yeah. If I have some case of free of charge, do you want to enjoy this procedure?
I think maybe could have a change.
Okay, I know, I understand. All the men worrying about our side.
Okay, so Dr. Bac, I have a question for men. So if size doesn't matter, or do you have any advice for men to increase the quality of sexual activities?
I think actually from my personal experience, I am small, I am not large, but whenever I see but every girl that I can see her, or they all feel that I'm a happy man. You see, because I think actually I think size size isn't important, much more important in the sexual activity, because in sexual activity, I think the most important is the man who know how to sharing their feeling with the female, and then the second, the man should keep their fit, yeah, and they keep it both physical health and mental health. For example, men should give up some bad habit. For example, smoking, heavy drinking, lazy in doing exercise. So I think men should spend time to do exercise regularly. Yeah. Each day I only spend 15 minutes for running around my neighborhood. So I think it's okay for me. So you see, if you could see me, I am very, very thin, but very strong. I always keep my fit, both mental health and physical health. Yeah.
Doing exercise regularly.
Yeah.
And healthy mental health.
Yeah.
Okay. Yeah, I see a question from a woman that if a man feel embraced or not confident about his size, and so what should women do? Just console or encourage him or ignore? Can you give the women some advice if their partner always feel his size is small?
Yes, I think that is a nice question, because a lot of women would like to know the answer. Every day when I consult with a female partner, I always talk to them that female partner is a good doctor at home, because it's her role is much more important than the doctor's roles. Because I am doctor, even though I am doctor, but I don't live with him at home. So you are a doctor, a good doctor. So give him some encourage in the suitable time. For example, don't make him embarrassed, because you know, every man think that they're small, so they couldn't help the women to reach organ. It is afraid in his mind. So I think the woman should eliminate this thinking in his mind. And you sometimes maybe you can pretend that you are you are welcome, yeah, a hero. You make me happy, yo. I think that makes men feel very so esteem and become happy, much more happy.
Yeah. Encourage him to be more confident.
Yeah.
Yeah, very useful tips. So in men couples, do you think size matter? Oh, okay. In a relationship, will we have a two men?
I think in case of men, thick with men, I think maybe size maybe size is important, because when they have sexual intercourse through the anus, it's different from the vaginal, because vaginal is usually shorter than the anus. So I think the in case size much important. But I think apart from size, yeah, it is the feeling is and love each other is more is another important factor, that not only size, according to my personally, yeah.
Okay. Yeah, thank you. It means that besides in the man couple relationship, so not only the vaginal, so I mean the anus canal, right?
Anus, yeah.
Yeah, or anal canal. They can change. Oh, okay. Quốc Trung asked about the evaluation of a successful surgery. It means that after the surgery of the penile enlargement, do you have any criteria or evaluation to see if the surgery is successful or not?
Yes, we usually put some criteria based on the cosmetic results, length as a penile, and satisfaction as a man and women. So usually we base on 3 kind of criteria, yeah, to evaluate the successful of the procedure.
So the first one is the length, right? And the second one is satisfaction.
Yeah, the first is length, the second is cosmetic, and the third is satisfaction.
Do you have any average length or average size increase after the surgery?
Yeah, as I said, as I talk about after surgery, we usually to increase about from 2 to 2 centimeter. It's not much. It's not much. Yeah. So sometimes the surgery is to it's one of the psychotherapy for patient, because they thinking that they have undergone a surgery, so it's effectively.
Okay. So proper psychotherapy is enough, right?
Yeah.
Khánh Linh asked about besides sexual activity, does penis size affect any other problem in life?
Wow.
I think this is broad.
Actually, I don't know about the roles of penis size in other function. I only know in sexual activity. Maybe in urine, it's I don't know. It's actually because for both people in for urination size doesn't matter, because women have no size. Yeah, they's very happy, satisfied with urination. So the men no needs a large penis for urination. But I think maybe it can size can influence to the self-esteem of men, because as you see, as I talk about penis size symbols of all the men, yeah, not only Asian, not only Asian men, because it is a symbol of men power. So I think.
Okay, yeah, I see the point. So if men want to improve or want to make their penis larger without surgery, so do we have any method or any way to make the penis larger without surgery?
Yes, we have another method apart from the surgery, is taking medicine, but taking medicine only effects when the patient under puberty,
Puberty. Oh.
puberty, yeah, pre-puberty, yeah.
Oh.
Because when the man overcomes the pre-puberty period, the testosterone does not effect anymore.
So the size, the penis size also depends on the testosterone level in the male.
Yeah. Yeah.
Could surgery make the penis harder? Okay. Thank you, Bac Thành. Could surgery make the penis harder?
Yes. Nowadays we have just carry out one kind of surgery that we penile implantable surgery, yeah, placement. That means we use one kind of device that makes the man erectile properly, yeah. IPP, yeah, IPP, penile,
prosthetic.
Yeah, prosthetic, yeah, IPP, yeah.
IPP, right?
I forgot this word, but this is one of the kinds that makes a man reach the erection, yeah, properly. Inflatable, yeah. Penile inflatable.
Inflatable penile prosthesis.
Yeah, prosthetic. Yeah.
Okay. Yeah. Thank you for your answer. And we have another question from Dr. Bac. Can you tell us what is your examination schedule in the next week on Hanoi Medical University? Okay. In case of men with want to make a schedule or make an appointment with you, so how can they contact with you, or how can we make an appointments in advance to see you?
Okay, so if you want to see me or your partner want to see me, you can contact with me on the Facebook, Dalos, or my telephone number. Because I only working at Hanoi Medical University Hospital during the work day. At the weekend, I don't have any schedule. So I think if you want to see me, you should go to the hospital and send me a text in advance. Yeah.
Do you have any hotline to make an appointment before, or go directly into the clinic?
Normally, patient contact with me through the hospital hotlines. 09019 01920024. Yeah, I will send after that.
Okay, so yeah, Dr. Bac will send you his contact. And the last question, Dr. Bac, long foreskin is cause a premature. Is this right? Premature.
Long
foreskin.
Long foreskin. No, I think until now there's no evidence between there's no evidence about the relationship between the prepuce and ejaculation of men. Some author think that when the men have a long prepuce, it can make premature ejaculation, but other authors argument with this theory. Until now, we don't have enough evidence about this relationship. In my practice, I don't use circumcise for treatment premature ejaculation. I don't use a circumcise for treatment of premature ejaculation.
Ah, premature ejaculation. Oh,
Yeah.
okay, I see. Okay. Yeah. No, okay, thank doctor. One person asked about if a man cannot create a son or a daughter with his wife. It means infertility, right? So what the man should do? Oh, in the case that the man have problem with his reproductive function or in fertility. So what the man should do?
I think the most important thing that we have to know exactly the problem, the condition as a man have suffered from, because each man there are a lot of conditions that can cause male infertility. So we should know exactly what is it, what are they. So in this case, I will give him an advice.
Okay.
For example, if a man only have abnormal in semen analysis, yeah, I think it's the most important thing in this case is we should advise men stop smoking, heavy drinking, using some multivitamin or sometimes antioxidant, yeah, and eating some orange juice. Yeah, orange juice is very, very good for men health. So I think they should drink orange juice twice a day. Yeah.
Orange juice.
Yeah, orange juice.
Okay, so the doctor said that maybe we should find out the causes of the disease and then give the advice, right?
Yeah.
Okay. Yeah. So I think the duration or the time is limited. So maybe we should end the Q&A section here. So if you have another question, so maybe Dr. Bac, can you show your contact number or the way that they can get contact with you in case they want to discuss more topics?
Yeah.
Perimeter.
Yeah. You see? No. Okay. Oh. Can you see my screen?
Yeah, I can see your screen, and maybe you should scroll down at the last the final slide.
Okay, question. Yeah. Yeah.
The final slide, right? This one?
Yeah.
Right.
It's okay.
Yeah, so in case that you want to see a doctor in Hanoi Medical University Hospital, so you can contact with him via Zalo group or email, right?
Yeah.
Okay.
My phone number, yeah. Okay.
Yeah. So we have only one question. Is if a penis is long but it is pre-metal, it means surrounding is small. So is it good for sex activities? So this is the very last question.
What can you repeat these questions? Yeah, okay.
if the penis is long, right? But the perimeter, it means surrounding, is small. So is it good for the sex activities?
I think for most women, length doesn't matter, but diameter is more important than the length. So I think in this case, with the small diameters, we have some methods for make it large. We use some. Usually, we use some device, to implant on the penis.
Okay. Yeah. Thank you very much. And I think this is the last question for today. And this is because the time is limited. So maybe if you have any question, you can send in the Zalo group, and I send to the Dr. Bac later. So I think that's all for today. And I hope that you have some messages to bring home. And once again, thank you, Dr. Bac, for spending your time joining with us today. And thank you, everyone. Can you share one thing that you learned in the presentation in the chat box to let me know? Can you share with us one thing that you impressed or one thing that you learned in the presentation to let me know? Okay, thank you, kindly.
Thank you.
Okay. Many participants saying thank you to you, Dr. Bac. And yeah, and I also want to say to send a big thank you for you for spending your time in this presentation. So I hope that we have another chance to work together, and we should share more information to our audience in the next section.
Thank you, Ms. Jung, to organize this room link today. And then if all of you interested in my specialty, so I think the next time we will create another chance to talk about the center. Sexual medicine, for you, and sexual education in community. I think it's a good idea for both of us.
Yeah, okay. Thank you very much, and see you in the next section. Thank you everyone for gathering here today and spending your time joining us. And see you in the next section. Bye-bye.
Bye-bye.
Sleep tight.
Thank you, Miss Jung. Bye-bye.
Okay.
Đấy, thế là hoàn thành một cô Dung rồi nhá. Thì
anh cảm thấy như nào anh?
Cô Dung phải tiếp tục dạy dạy anh đấy nhá, không được bỏ giữa chừng đâu.
Anh phải chăm chỉ lên cả. Anh cảm thấy như nào sau buổi ngày hôm nay ạ? Anh cảm thấy như
anh nghĩ là anh có cơ hội để anh nói tiếng Anh mà.
Tốt hơn rất là nhiều so với lại các buổi đầu tiên đúng không ạ?
Ừ.
Đấy, em thấy tốt mà, em thấy là dần dần ấy thì mình sẽ cải thiện được nhiều hơn thôi, và dần dần nó sẽ trở thành thói quen ấy. Đó, đấy, nhớ cái hôm đầu tiên anh bác gọi điện, cô Dung ơi anh không biết nói.
May thời gian vừa rồi có áp lực anh mới nói đấy, còn nếu không chắc cũng chả nói. Bỏ lâu lắm rồi. Thôi bây giờ anh sẽ restart lại.
Vâng, anh nghĩ là anh cứ luyện lại từ dần dần, sau đấy thì mình sẽ có những cái chương trình, ví dụ chẳng hạn như là cứ khoảng 1 tháng rưỡi. Sau một cái chương trình học thì chúng ta sẽ có một cái chủ đề nào đấy, như kiểu là chủ đề ngày hôm nay này. Sau đấy thì chúng ta sẽ
chủ đề này tốt đấy, thì mình sẽ đưa những cái chủ đề này gần gũi này vào để coi như một cái chương trình sexual education cho mọi người.
Vâng, đấy. Thì em nghĩ là
đây là lĩnh vực cũng mới, mọi người ít có thời gian đọc, ít có thời gian để ý đến.
Em cũng thế. Em phải thú thật là sau khi dạy anh thì em cảm thấy như là em tự nhiên là kiến thức của em nhiều hơn. Còn trước đấy là em cũng chưa bao giờ em nghĩ tới, em cũng không ngờ, kiểu rất bất ngờ ấy, kiểu khi anh chia sẻ thì em mới biết ấy. Còn trước đấy thì em không biết.
Đây là can start from 5 a.m. đấy.
Okay, actually Nguyệt is my roommate. We have shared the same flat, and then she knows that every 5 a.m. and I get up very early and talk with you, and sometimes she overhear about it. The penis.
Thế
Okay.
nhưng mà nào cô Dung quyết định nhá, thì sao học buổi tối nhá, nếu mà không thì học buổi tối hay là buổi sáng. Nhưng mà bây giờ chỉ tuần học 3 buổi thôi cô Dung ạ. Học nhiều buồn ngủ lắm.
Em sợ là anh cũng không dậy được, tại vì là buổi sáng thì nhiều khi anh cũng hay làm việc ban đêm ấy, nên là nhiều khi là buổi sáng.
Không, nếu mà xác định học buổi sáng anh phải đi ngủ sớm. Anh nói với cô rồi, đi ngủ
Nhưng mà làm
sớm
sao
cho
để đi ngủ sớm được anh?
đi ngủ sớm cho nó đẹp da, thì anh cứ xác định mình đi ngủ sớm cho nó trẻ thì cố gắng đi ngủ sớm để sáng dậy sớm.
Nhưng mà buổi sớm em cảm thấy em chưa tỉnh ngủ với anh ạ. Em không
Thì
biết là
không
làm sao để đi ngủ sớm.
thì học buổi tối bây giờ cô rảnh buổi nào?
Buổi tối bây giờ em là full hết lịch, kín hết lịch các lớp rồi. Nhưng mà nếu mà có học thì học từ 9:30 đến 10:30 anh.
Ừ.
Okay, stop.